Hi guys, so my previous video talked about concerns that we might have as a mother, pregnant or breastfeeding. And the one that I discussed prior to this video was on smoking and whether or not I can, breastfeed while I'm smoking. Today, I'm going to do a video on whether or not I can take over-the-counter medication. Really any type of medication. So whether it's prescription based or over the counter, can I, take it? So a lot of times when a mom is breastfeeding and maybe you get an infection or, something happens, you need pain medication or just having a cold or something like that and taking medicine. A lot of times, if your doctor knows that you're breastfeeding, they will make sure that whatever medication they put you on, that it's okay and it's safe to breastfeed. Now, the over-the-counter type of medicines, many of those are safe to breastfeed while on them, but you never want to take anything, without checking first. And this is really important. You need to make sure that whatever information you get is from a reliable source. So if you want to know whether or not it's safe to breastfeed and smoke, is it safe to breastfeed and take over-the-counter medications? Is it safe to feed my baby even though I'm sick? And, the list goes on and on. You need to go to reliable sources. So you need to go to government websites, CDC, World Health Organization, and UNICEF. Those are an NIH, National Institute of Health. Those are some websites that have the information that you would need that can answer those questions for you. Now, a lot of times, your lactation consultant at the hospital, a lactation counselor like myself, we can help you a little bit to gauge whether or not something that you're taking, or if you're sick or something like that, we can kind of help you know if it's safe to breastfeed while you're doing those things. Now, a very well-known website, it's a database. It's the United States National Library of Medicine. It's called LACTMed, LACTMED, and I'm going to put that below so you can look at that resource on your own. And they have a database of drugs which breastfeeding mothers could be exposed to. So you can definitely look at them and they will tell you if it's safe to breastfeed or not. There's also a book called Medications and Mother's Milk that is written by Thomas Hale, Hale. And again, I will put that below. But he wrote a book, and typically, I think I have 2010 book, but a lot of lactation counselors and consultants will have an updated book on that, so you can also call your lactation consultant, lactation counselor, peer counselor at WIC, and get some information from them as to the medicine that's safe for you to take. There is the Infant Risk Center. It's an internet telephone resource. It's internet and telephone resource based work by Dr. Hale, so you can look at that as well. And like I said, I'll have all this stuff below for you. Now, another thing that's important I should say, okay, let's use a scenario. Let's say you get sick. Let's say you have a C-section and you get an infection after. The first question that you would want to ask is, what is an appropriate medication that I can take that will allow me to continue to breastfeed? So ask for a substitute. Also, if let's say you're on a long-acting medication, you can ask for a substitute that's a short-acting medication that would be a little bit safer. Then let's say you are on a medication that you cannot breastfeed. What are you going to do to be able to continue to feed your baby maybe not at that moment, but as soon as you're off the medication, how are you going to feed your baby, and are you going to have to wean your baby, depending on, I guess, where you're at and how old the baby is. And then what is your plan for feeding the baby? How are you going to feed the baby, once you're on this medication? Now, there are medications out there. There are antibiotics out there that doctors say, is not safe for a breastfeeding mother. Now, yes, it's important to listen to doctors, your doctor, regarding these medications, but you really need to make sure, like I said, that you're going to a reliable source. Sometimes the person that you're talking to is not completely informed about the safety of the drug. And in their mind, it's just better to say, no, you cannot breastfeed while you take this. But if actually research is done, or you talk to somebody who is informed and knows the medications, you will get a different answer. So you need to do some research on your own. If your doctor says no, for instance, you can get some information on your own to find out if he is right or correct, or if maybe he's misinformed. So those are research things that you would want to do to gauge whether or not you feel you should continue to breastfeed or to stop. So if you are given a medication and there is nothing else you can take, and let's say you're going to get this antibiotic and you're on it for 10 days, how are you going to feed your baby? Well, that's where you would want to consider a hospital grade pumping and dumping. And then you have to figure out what you're going to feed the baby in the meantime. And this is where we always would tell moms, start pumping once a day and storing it in the fridge or freezer, just for cases like this. If you do get sick and you can't feed your baby, or you're separated from baby for some reason, that baby and you still have a source that you can go to if you are sick. So you're not going to worry so much if you're on a medication that you can't breastfeed on, because you have that there, in an emergency case. So if this doesn't apply to you now, or, in the future, just future knowledge, pumping every day, and storing milk in the freezer is the best thing to do. It's always good to kind of think in your mind about 2 weeks, worth of milk would you want stored in your freezer. And that will protect you from certain times when this could happen. My sister once knew she was going to be traveling, and she knew that while she was away, it was going to be like a week that she would be away, and she knew she would have baby with her, but she knew that she wasn't going to be able to breastfeed as easily as if she's at home. So right away, she started to pump a couple times a day and just start storing it. And it got to the point where she had so much, she ended up leaving it in the freezer because she forgot that she had it. She still had 4 left. So it is definitely possible if you kind of plan ahead for certain things. But like in a case like this, you would want to get a little bit of help, kind of get, somebody's opinion. And then, like I said, pumping and dumping, and how would you feed the baby in that case. And I am going to provide the resources below for you to be able to do research on your own on what medications, both over the counter and prescriptions, that are safe for you to take while breastfeeding. And just because a drug might be safe when you're pregnant does not mean that it's safe when you're breastfeeding. So never make that assumption, because that is not a lot of cases not true. Let's see. I just want to make sure that I hit on everything. Also, when you are taking anything, whether it be an over-the-counter or a prescription, you have to be aware of the possible changes in your milk supply. For instance, if you take something like Benadryl or any type of allergy type medicine, or upper respiratory, the cold medicines that have pseudoephedrine in it, that does cause your milk supply to drop. So you do not want to take something like that. Also, certain medications can cause certain behavior in your baby. For instance, when I was when I had my daughter, I was put on Prilosec, and the doctor said it was safe, so I went ahead and I looked it up myself, and it was okay. So I went ahead and did it. But after a couple of days on it, I noticed that she was really gassy and really colicky. I decided to stop because I felt that I didn't want that for her, and I could go through. I just felt, well, I can deal with heartburn. I don't want her to suffer with the colic. And of course, it wasn't going to kill her, but that was a choice I made, and you may make a choice similar depending on how you feel and the baby's behavior. You also want to think about other effects on the baby. Some medications can cause your baby to have a slower growth. So you want to consider all those factors, whether or not, you can breastfeed or not. Now, there are cases where a mother cannot breastfeed, but there are many, many, many cases where a mother can breastfeed. It's actually more, it's more common for a mom to be told that she cannot breastfeed, and she actually can. So just remembering the side effects of not getting breast milk versus breastfeeding are higher, and the benefits are better if baby is breastfed. They outweigh a lot of the risks. But again, always look at reliable sources. Always get second opinions, look up information, and get more than one yes or more than one no. If somebody tells you no, look for some more no's. Make sure other people tell you no. If somebody tells you yes, look for more yeses, just to kind of back yourself up a little bit. Okay, so that is the information there for if you are on any type of prescription medication or an over-the-counter medication. My next video will talk about, can I breastfeed even though even though I'm ill. I was going to say it in like, even though my mom is ill, but like I'm the baby. But that is another concern that moms have. And also, can I breastfeed when I'm pregnant? Can I breastfeed? How do I breastfeed and wean? Concerns about weaning. So those will be some more videos that I'll probably do over the next week or so. I hope that these two topics that I post today, they will be for Tuesday and for Thursday. I hope that those help. If you have any questions or any concerns, please comment below. Please email. And again, I will be sure to have all these resources in the description below so that you can go to them yourself and have them in your resources, whether it's online or phone or whatever it is. You will have those at your fingertips to be able to check and to be able to get the answers that you need. So I will talk again to you guys soon. You guys all have a great day, and I hope that you will subscribe and continue watching. I'll talk to you later, guys. Bye.